Primetime Live joined the University of Botswana at the just-ended 2019 edition of the Pan-African Health Informatics Conference, Helina, hosted by the University of Botswana eHealth Research Unit under the Department of Computer Science, in collaboration with the Ministry of Health and Wellness and other key stakeholders.
I'd like to be that we're all aware that implementation of digital health intervention in Africa at large for achievement of universal health coverage right here in our country. With that statement said, we get to join Africa at large together with University of Botswana for the 2019 Helina Conference.
The conference, which was the first of its kind held by the university, provided a platform to showcase digital health interventions that have not only shown benefits but are also sustainable. The 2019 edition of Helina Conference was attended by local, regional and international experts in digital health from across academia, NGOs, private and public sector.
So we're very excited to host this for the first time in our land, in Botswana. If you recall, we had two health informatics conferences in the past. That ended in 2013, the last one. So we are very excited to host the third Health Informatics Conference under Helina in 2019 with a theme from evidence to practice implementation of digital health interventions in Africa for the achievement of universal health coverage. A very packed theme indeed, which I want to believe speaks to three things in our context. The first thing speaks to universal health coverage, which is which actually is enshrined in one of the SDGs, SDG number 3, and also is aligned to one of the pillars of our Vision 2036, which speaks to healthcare or quality healthcare for all, or inclusive quality healthcare, irrespective of gender, age, or economic status.
I'm particularly honored and humbled to be welcoming you on behalf of a consortium that organized this meeting, or the local collaborating partners, which is the University of Botswana, BITRI, the Ministry of Health and Wellness, Ministry of Transport and Communications, and the Botswana Health Information Management Association. Having worked in the Botswana health systems for many years and different levels of care and governance of the system, I see immense potential and promise that health informatics holds even to the lowest income countries and their populations, especially as we all are working hard to realize the Sustainable Development Goal, and especially SDG 3 and universal health coverage, which seeks not to leave anyone behind.
The objectives of Helina are, amongst others, to develop a strategic plan for the sustainable development of health informatics and e-health in Africa, to develop education and research programs adapted to the African context, fostering alliance with government and the private sector.
Ladies and gentlemen, this conference could not have come at a better time than a time when, as a country, we are gearing up to embrace the fourth industrial revolution. The choices we make today about how our healthcare is managed, controlled and utilized will shape the future of our healthcare management and patient care. As we are aware, digital health encompasses many subsectors, including e-health, m-health, telehealth, telemedicine, and health IT in general. In Botswana, e-health environment has been developing over time. We recently finalized an e-health strategy, which is a great opportunity to ensure that e-health contributes to the strengthening of the health system and health outcome of our people. Botswana e-health strategy aligns with the 71st World Health Assembly resolution. That resolution is WHA 71.7 on digital health adopted by the World Health Organization member states in May of last year. The resolution urges member states, and I quote, to assess their use of digital technologies for health, including in-health information system at a national and sub-national levels, in order to identify areas of improvement and to prioritize, as appropriate, the development and evaluation, implementation, scale-up, and greater utilization of digital technologies.
We know this is a relatively new discipline, but we really try to encourage you to form national societies and just bring together professionals that have an interest in promoting health informatics in your countries. There's several countries that are now having fairly vibrant, fairly functional associations, and you can work with them. Helina can help facilitate countries' inter-country collaboration just to help you get set up, get started, learn from the mistakes that others have made, and just get going. I mean, I think having these national societies is a very great opportunity to interact, to learn, and also to share. I mean,
The hosting of the conference in Botswana by the University of Botswana shows just how serious the government takes issues of health, and it shows the efforts of government in trying to make use of other means of transforming the health sector.
Computing is no longer the domain of experts alone. It's everywhere, and it needs to be understood and mastered by almost everyone. So it's no longer a luxury, to learn computing. It's everyone's, role in life, whatever you're working on, to know a little about computing. And Jupyter is language agnostic. You can use Python or R or Scala or Spark or F#, C#, C, PHP. And what it is it's really about empowering humans. It's human-centered interactive computing and science for the masses. And project funding, it receives a lot of funding from these organizations. And it's in use in a variety of organizations, including a training program that we run. We call it the GEEKS program. So we've been implementing this program in several countries now in Africa. GEEKS is an acronym for Growing Expertise in E-Health Knowledge and Skills. So it's easy to remember. It's a GEEKS program, and it's Growing Expertise in E-Health Knowledge and Skills. So this is just essentially a workflow for using notebooks, and I'm not gonna belabor this graph, but you can see that there's many pathways to, where you can start and where you can end up, with Jupyter Notebook.
Of course, we need to give a kind of special training for health workers so that they can utilize, make the most of this kind of new digital solutions. And also, in some cases, patients and a patient's family, we need to give some kind of proper medical education related to this kind of new solutions. Let me show you an example of that the Amy's case. Actually, that Ministry of Health in Malaysia, they are utilizing that technology, and then they set up a dashboard in their office, and then they are trying to, they are operating in a kind of a control tower, command center. But at the same time, the web-based apps for the ordinary people, citizens, are also operating in Malaysia. But they are already they installed that kind of systems for citizens as well, because they make a judgment that they should do, taking a balance between that kind of health risk and also economic impact. But in order to smoothly install such systems into society, we need to advocate to people or give some trainings or give some education in some cases, I think.
The most important phase for us in all of this is the post-implementation phase. If you look at the sketch there, we are currently monitoring our implementation process, the data migration process. We are documenting every step of the way, and we're logging all issues. We are also evaluating, we have plans to do an evaluation of the implementation process, the data migration process. We are also documenting all of this, which we will need to feed back again into our developmental process so that we can end up with a more robust application that meets our need and help us also to support HIV programming And ultimately, we're also looking at the government adopting this, with many of us serving in the EMR Technical Working Group in Nigeria. We are working very hard to see that since this is free, this is open source, the government most likely would adopt this as an application that we will use in other in other diseases of public health importance. So we continue to monitor weekly. We continue to monitor functionality assessment. We continue to monitor software and network maintenance. We continue to ensure that backup systems are in place and that we don't lose data.
To this end, the government realizes that many are the potential benefits that can be obtained from the use of information technology in healthcare are immeasurable, especially in the provision of patient care services in remote areas where public health systems can be a great distance from patients.
Ke eng dilo tse leng gore gongwe la di dirisa kana la di dira go hegosa kana go dira gore dilo dingwe di nne motlhofo when we speak of healthcare? Talk about those cell phone apps and everything.
It strengthens health system. What it does is that we develop software that is put in the cell phone, and now you can use the cell phone to do the screening of the eyes that you normally do, in the health centers. All those nurses that they use the chart for you, you can simply do it on the cell phone when using the PIC solution. However, I don't want to say that it replaces what the healthcare or the health nurse can do in the hospital. You can use our solution to screen the eyes, but again, then go to the hospital to confirm and then get some medication.
Digital health is still fairly new, particularly in the context of Africa, but we have experts. We also have, international bodies such as WHO, CDC that are actually, driving the mandate, and they've got offices in Africa. So the goal is for us to work with them so that we build that ecosystem in Africa, because the health landscape is more or less the same, wherever you go in Africa. So the goal is for us to learn from them, as Botswana and of course other countries can learn something from us as well, so that we see what policies they have in place, how they implement it, so that we can also introspect and see what we can do as a country also to have a robust digital health infrastructure and ecosystem in Botswana.
The theme particularly spoke to the need to incorporate and use information technology or electronic communication tools, services and processes to deliver healthcare services.
Prime Time Live.